Could you summarize the important problems that you encounter daily as a physician?
In 2003, I started collecting the common symptoms which makes patients anxious to ask an emergency appointment. When I compiled a list of thousands of them, I came to know that there are 12 symptoms which are very common, like headache, flu, fever, cough, rashes, tummy pain, and these are the common symptoms which makes patients feel anxious. And what I have done is I have reduced the symptoms of all the diseases into 9 common ones, and based on that, patients can get the advice.
What can your book do to help people?
What it does is, if a patient has a symptom, they can go and read up about that symptom, and there are 3 symptoms to choose. If all 3 symptoms are right, that means to say they shouldn't sit and waste their time waiting for the family physician to examine them and tell them what to do. They must go straight to the hospital because that will be an emergency. If there are 2 red symptoms, that means to say they need to be examined or maybe need a test or a procedure performed to diagnose the condition first. So they must consult the doctor within 24 hours. And 1, you can deal with it by telephone. In England, we have what is known as nurse-led practice, where nurses will help you to diagnose. So green color, they can go to the nurses. They don't need any clinical examination. It's just taking a decision based on the history. That's what I've done.
How would you describe your mission? You also talk about apps to help fight infections. Explain.
The app, it asks you to put in 3 symptoms. And when you put 3 symptoms, it will show you the color, whether red, green or yellow. And it gives you all the information what you need to know about these 3 symptoms. And then there is another app for the doctor. The doctor can use the Maya Doctor app and create his own list of symptoms. So I am just trying to set up a group, like a WhatsApp group, in a local area, linking doctors and the patients. This will help me to identify 3 common symptoms so that I can easily pinpoint and say there is an infection epidemic occurring in Ethiopia or somewhere, because the symptoms are identified and we can mark it as infectious diseases. And if a cluster comes, we can quickly identify the place where the infection starts spreading, and we can cordon it off. We don't want Ebola-like infection to spread all over the world before the WHO or the CDC decides what to do. And that is a disaster. If they take 8 months, millions would have died. So that's why my app is very useful to identify the location, hospital, country, state, and even at home. And that's the idea.
Most of us are confused and anxious because we can't separate serious illness from minor illness, and then it introduces anxiety into the equation. That can be disastrous. How do you approach that?
That's exactly what Maya does. Maya I differentiates between serious and not serious infection. I'll give you an example. If a child has high fever, people always assume, high fever, the child must be really unwell. To tell you frankly, high fever is not what I will worry about. Why? Because virus infections will increase the temperature quite high. Bacteria is like humans. They don't like the temperature to go above 38 degrees. So the temperature usually drops. And based on that, we can differentiate between virus and bacterial infection. Bacterial infection is the one which will kill. Virus infection rarely kills.
Who did you write the book for?
For the patients. For people like you.